I feel greatly honored to be here today to make opening remarks on the occasion of the commemoration of the World Population Day for 2015. This is the day when the world focuses its attention on the urgency and importance of population issues, particularly in the context of overall development. The activities of World Population Day help to raise awareness on population and its relation to the environment and development. As you know, the theme for this year's commemoration is Vulnerable Population in Emergencies. This theme could not be better, Honorable Minister, after Malawi experienced the devastating floods of early this year in 2015, when a significant number of the population in more than 15 districts were affected and needed humanitarian support. Honorable Minister, ladies and gentlemen, a recent United Nations report has estimated that the number of populations, that means the number of people affected by humanitarian disasters exemplified by the recent floods in Malawi, has risen to significant proportions, and it's estimated at 60 million as at the end of 2014. Those of us who joined the government of Malawi in providing support to the people that were affected by the floods observed how the floods caused sufferings to all who were affected. But we also noticed how people were affected in different ways. We saw that some sections of the community were more vulnerable than others, and some sections of the population needed special attention and support. Those sections of the population are the subject of today's commemoration. When emergencies like the one which affected Malawi this year occur, women, girls, and children in general become more vulnerable and have special needs that are unfortunately sometimes ignored. They are not ignored in bad faith. The people that provide support do not realize sometimes that some sections of the population are more vulnerable than others, so the special needs are ignored. During emergencies, women need services for safe pregnancy and childbirth and protection from gender-based violence. During times like these, efforts to secure the safety and ensure the dignity and health of women and girls are necessary to promote the well-being of families and communities. It is for this reason that I would like to emphasize the importance of always making sure that the rights and needs of women and girls are at the forefront of humanitarian response. This is necessary to maintain their dignity and restore their safety and access to sexual and reproductive health services. Even under normal conditions, reproductive health complications are the leading cause of death and illness among women of childbearing age. In humanitarian situations, it is estimated that at least 1 in 5 women and adolescent girls are likely to be pregnant. As skilled birth attendants and emergency obstetric care are often become unavailable in situations of emergency, pregnant women and girls' vulnerability to death and injury is further exacerbated. Women and girls also face much higher risk of abuse, sexual exploitation, violence, and forced marriage during humanitarian disasters. In addition, many women who survive a crisis become heads of households with the sole responsibilities of caring for their children and their families. They often have to overcome immense obstacles to provide health care for their children, for the sick, for the injured, and the elderly, and they bear the heaviest burden of relief and reconstruction. As such, they often neglect their own needs. The theme for this year's World Population Day presents all of us an opportunity to highlight the special needs of women and adolescent girls in emergency situations. One of the priorities of the United Nations in emergencies is to empower and safeguard the well-being of these vulnerable populations during emergencies. We work closely with governments and local partners and local authorities in these situations to make sure that the needs of vulnerable populations are met. As UNFPA, we deploy hygiene kits, obstetric and contraceptive supplies, trained personnel and other support to ensure that these needs are met. Our aim is to ensure that women and adolescent girls' rights to sexual and reproductive health is protected in development as is in emergency situations. On this World Population Day, we call upon the government of Malawi and the international community as a whole to redouble efforts to protect the health and rights of women in emergencies. We reiterate the fact that we must all work together to ensure that perpetrators of sexual violence and gender-based violence in general are always brought to justice. By prioritizing health and the rights of vulnerable population in our humanitarian responses, we increase the prospects for a more just, stable, and peaceful country. At this point, allow me, Honorable Minister and ladies and gentlemen, to commend the government of Malawi for its leadership and coordination during the recent floods. We made sure during the recent floods that the needs of vulnerable populations were met, and particularly reproductive health was fully integrated in the response. I know, Honorable Minister, most of us are aware that we did not have one single maternal death during the recent floods, which is unusual and which is a direct result of the efforts of the government, the partners, and all the others that were involved in this response. I would like to end by reaffirming the commitment of the United Nations to working with the government, civil societies, local authorities, and all of you present to ensure that in future emergencies, but also in the development process, the needs of the vulnerable population are always kept as priority and are always met. Thank you very much. Honorable Minister, I'd like to request